Hello, Dr. Vikki Petersen here. I want to talk to you today about something that we see very often at the clinic, and it's something that for the individual that has this problem, it can be extremely stressful. It can involve hospital visits, medications that are unnecessary, and it's a very large problem. And we here at the clinic, because we're multidisciplinary, we meet as a team, all the doctors, and sometimes things that are very easy for us to fix, we don't necessarily ponder over too much, you know. So this particular problem is something that we understand. It's not hard to fix, even though it's very debilitating for the person prior to someone arriving with it. And so when a patient recently came into the clinic and we were reviewing her case, and the doctors quickly said, oh, it's this, and sure enough it was, it suddenly struck me though that more people need to know about this. So what I'm talking about are panic attacks. They're called panic attacks. They're called hiatal hernias, which means your stomach goes into spasm and pushes up on your diaphragm. So let's look at a little anatomy. So up top we have our lungs. Down below we have the digestive organs, liver, spleen, stomach, etc., etc. But above where the heart and lungs are, and then before the digestive organs, there's kind of a sheet of muscle called our diaphragm, and it separates those two areas. And the diaphragm moves every time we breathe. So when you take a deep breath in, the diaphragm goes down, lets more air come into the lungs, and then as you exhale, it comes back up and it forces the air out of your lungs. So of course, regardless of whether you're asleep or awake, this diaphragm is constantly moving because we're always breathing. Now what happens for individuals with this problem, sometimes it happens when they're at rest. This particular woman that I'm thinking of most recently, that happened to her. So often it happens when the person is lying down, they're in a deep sleep, or it's nearing toward morning and they're starting to come out of sleep, and this happens. And here's what occurs. The diaphragm goes into spasm. And so in other words, that nice fluid motion of it when you inhale going down and when you exhale coming back up is not happening fluidly. And if you can imagine trying to get air and not getting enough, that's the feeling. So all of a sudden you can get a little panicky because you can't get a breath, and that can cause your heart to race, and of course get you feeling a little panicky and anxious because we need air. So a lot of times people go to the hospital with this, and of course their heart rate is increased because they're panicking, and the differential diagnosis, in other words, what they want to differentiate is happening. Of course, number one is this person having a heart attack? Is there anything wrong with their heart? And for these people, there's absolutely nothing wrong with their heart, and then often they're told, well, you had a panic attack or you had an anxiety attack, and very often they're given medications, which this particular woman was. She had had a history of going to the hospital for 5 times with this problem. They checked her heart initially, then afterwards knew her heart was fine. They gave her antidepressants, anti-anxiety medications. These did not help her situation. As a matter of fact, she really didn't do well on them, so stop them. So let's look at what the solution actually is. And this is an interesting one because it can have a number of different components affecting it. So number one, just below that diaphragm is your stomach. So what can happen in causing that spasm is that the stomach spasms, it pushes up against the diaphragm, and then the diaphragm goes into spasm as a secondary response. So here at the clinic we find that most often with these cases there is a digestive component. The person might have bloating or gas or something like that, which of course is much more secondary as far as they're concerned to these panic attacks, which are of course very severe. And we often find a food sensitivity. So gluten is very common, dairy is very common, and there are others as well, food sensitivities that we see. But something's causing that stomach to spasm and push up against the diaphragm. Sometimes there are infections in the digestive tract, including the stomach. So we can diagnose those. Another thing that can happen is that the muscle, that diaphragm itself, is a bit weak. there can be a nerve component, a neurological component, and that is, we've seen this in people with neck pain, because the nerve that goes to the diaphragm actually comes from the neck. So sometimes someone can have it after they've had a neck injury. This phrenic nerve, it's called, that goes to the diaphragm and tells it to work properly the way it should, it is not working as well as it should, so that communication from the brain to the diaphragm that happens via the nerve is not occurring as it should. So we can have a neurological component. We can have weak abdominal muscles causing the diaphragm to not be as strong as it should be. So that brings in physical therapy. The nerve problem can bring in chiropractic. The stomach problem can bring in clinical nutrition. And if there's an infection, that can bring in internal medicine, as far as getting a prescription for an antibiotic or something like that. So we find here at the clinic that these panic attacks tend to be multifactorial, including the disciplines that we use here. So as I said, it's kind of an easy fix for us, but how about those people that continue to suffer and are on these medications that have some nasty side effects, antidepressants and anti-anxiety medications? These are not without dangerous side effects, and that's not getting to the root cause of the problem. So I wanted to share this information with you because it's really not hard to fix, and many people are suffering with this. So if it's you or someone you know, please let them listen to this, and let me know if you need any help finding someone to help you with it. All right, so until next time, I wish you very good health.